name is Diane Lane. I'm the Head of Service for Intermediate Care for Medway Community Healthcare. By profession, I'm an occupational therapist, but here at Medway Community Healthcare I lead a number of teams working in intermediate care, along with my colleagues in the urgent response pillar as well. So the teams across intermediate care and urgent response include our urgent response ACPs, which are advanced clinical practitioners. We've got therapists, which include physiotherapists and occupational therapists and therapy assistants. We've also got urgent response care management, who are made up of primarily social workers, but also we have some nurses and some occupational therapists within that team. We have our enablers team, who go out and provide support to people in their own home once they've come out of hospital, to make sure that they're getting their consistent input every day to help them reach their goals. And we've got our integrated discharge team, who support people coming out of hospital. So that's making sure that people go to the right place at the right time. Hopefully we're always thinking home first, so getting people home with any enablement support and any therapy that they need. Okay, so T-level students, we've been really lucky to have had a number of T-level students come through our doors and come out and shadow our teams. The last cohort we had for a period of 9 weeks, we had them for we had 4 students in total coming out, and they went across all the different teams. So they had experience in hospital, they had experience with our urgent response ACP team, and they went out with our therapists and our enablement team. So we were really lucky to give them that breadth of education, if you like, that breadth of experience to see what it's really like to work in a community, but really thinking about how people need supporting from an acute episode of illness, whether they're coming out of hospital or whether they're being referred in through our front door, right the way through to the end of their journey, where hopefully we re-able them and they're back to their health where they were prior to their acute onset of illness. So on any given day, by the nature of the service, we never know what's coming through the door on any given day. So it's a really exciting opportunity, and if you're a new student looking at entering the world of healthcare, it's a really great place to be. It gives you that difference every single day. So for example, if you're out in the hospital team, what you might be going up onto a board round, working really as part of that much wider multidisciplinary team, having conversations about what someone might need, what they came into hospital with, when they're going to be coming out of hospital, if they've got any family support, really using strength-based conversations around what's available in the community to support them and what they might need moving onwards. That might mean that they're going to go home with therapy. It might mean that they're going to go into one of our inpatient rehab units, or it might mean that they need to go to a nursing home or a residential home. But those conversations are really important. So getting in and having those conversations and really understanding what conversations need to happen to really support people moving on. Those patients that come in from the community, or our T-level students who've gone out with our community, either therapists or our advanced clinical practitioners, they get the opportunity to go into people's homes and to see what we need to do to keep people out of hospital and to get them back to where they were before going into hospital. So that's a really great opportunity to, again, see those conversations and see how the much wider multidisciplinary teamwork, working alongside our nurses, our therapists, our care managers, care agencies, voluntary sector. It's a really exciting role for students to get involved in, and to see those clinical conversations, what we do about keeping people safe, thinking about safeguarding conversations and those much wider things, all of those things that they've learned in college, they're going to see really play into action on when they go out with those teams. So yeah, really exciting for them. It's really great to have T-level students with us, to see their enthusiasm and their will to learn. That's a really great skill that those students bring to us. They invigorate us, and they remind us what it was like when we started off our journeys as clinicians. But also what it does for those students is it really tells them about how they can develop their career. And certainly within Medway Community Healthcare, we have our own apprenticeship programs, and we can help people who are just starting off their careers. And so I think that's really beneficial to the students, and it's really beneficial to us. We love in Medway Community Healthcare to grow our own, if you like. So if we can support students coming out of college with their new T-level qualification to come in and be employed by Medway Community Healthcare, and then maybe get onto one of our apprenticeship programs and maybe become senior clinicians in the future. So it's beneficial for us and it's beneficial for the students. We've been really lucky. We've had Taujet who supported us right from the get-go, identifying students. We've had students give us CVs, and Taujet's been really great, I think, at supporting those students to what does it like, what do we expect to see on someone's CV. We're currently working on some mock interviews with students as well, which I think will be really promising and really helping to develop those skills for students coming through and for future employers. We've had joint introduction day, so that's been really positive, because it's really daunting, isn't it, when you're you're just coming out of college into the workforce. What does it look like? Being introduced to the clinicians you're going to work with, having an understanding of what that day looks like. So Taujet's been really great at supporting not only us as employers or future employers, but certainly those students, and giving them that reassurance, which I think has been really helpful. While the students were on placement, Taujet again stayed in contact with us regularly, which is really great to make sure that those placements ran smoothly, which is really important. I think as clinicians, what we can find is that we're not necessarily certain about what the outcomes are for the students, what needs to happen at the end, what happens if something goes wrong. Hopefully it doesn't, but Taujet was always there for us, so that's been really great. And at the end, what we did together was we had just to get together a bit of a feedback session. What can we learn to make things better for the future? So that's been really helpful. We've been so lucky. The students that have come from Mid Kent College have been absolutely fabulous, and we've seen them grow in the 9 weeks that they were here, from the clinicians that didn't really know what to expect, understandably being a little bit nervous, a bit apprehensive, to coming out and just getting their hands in and identifying things. And that's been really promising for us, because actually that's what we want. We want to see students develop, and we want to see them into employment. We absolutely invite and implore students to apply to work for Medway Community Healthcare. We love to have new people coming through our doors, and new people that we can develop and see them through their careers and help them to identify, if you like, the career that they want to go into. So they might come in an assistant practitioner role and actually think, oh, do you know what, I'd really love to be an occupational therapist, or I'd like to be a physiotherapist, or I'd like to be a nurse. So what greater way to do that than to embrace students and to come in. So yeah, come and apply at Medway.